talking about peptide therapy, which is sort of the future of medicine. Right now, we have peptides for the treatments of like the diabetes, GLP-1 peptide, which is what you hear, Victoza, you know, advertised by pharmaceutical companies, things like Ozempic. This is where the future is at. These are little peptides, mean that they're portions of hormones. They're smaller sequences that are taken out and used to do almost the same work as hormones, but they're not hormones. And so they're a lot safer. Well, we're going to concentrate on three of them. One has to do with anti-aging and with boosting growth hormone. The other one is to help boost what we call hypoactive sexual desire disorder, which is seen, and it's FDA approved now for women with low libido, basically. And then the other one is called AOD, which is a peptide that's being used for fat loss, for fat burning, for people that are doing weight programs and are having trouble losing weight. And the way these peptides work is they actually hook onto certain receptors. Remember the lock and key, and they turn on certain functions inside the cells, especially in the brain or in the body. And most of the time, they work better if we're given an injection, usually sub-Q under the skin, almost like a B12 shot. So it's not a big injection, very small needle. Sometimes we can give them as little troches, little dissolvable tabs that dissolve under the tongue. But primarily, the one that I like using that I've had a lot of success with is one called CJC 1295. And it's combined with another peptide called ipamorelin. So it all comes in one injection. And what it does is it boosts growth hormone. As we get older, after age 30, growth hormone starts declining. And growth hormone has a lot of functions in the body. It helps build muscle, maintain muscle. It helps, burn fat. And it helps us keep us, skin tone, helps us with sleep, and it has so many functions. And unfortunately, it does get lower as we get older. And that's why people sometimes will say, I remember when I was in my 20s, I could eat a whole pizza, I could go out to drink, I could do so many things and be ready to go the next day and not gain a pound. That's growth hormone, and fortunately these days, people are also deficient in growth hormone because they either have sleep apnea, obesity, so they don't get into deep, uninterrupted REM sleep. And growth hormone is usually released after 3 or 4 hours of uninterrupted sleep, and it's usually released in like pulses. So this medication, this peptide, helps our body make our own growth hormone. It stimulates the receptors in the pituitary gland to release growth hormone, and so it's better than giving growth hormone because growth hormone, first of all, is not safe. It's very expensive. And unfortunately, if you give too much growth hormone, you could develop diabetes, insulin resistance, or you stop making your own growth hormone. Similar to when you give testosterone. If you give somebody testosterone that's not supposed to get testosterone, um, instead of boosting it, you give it to them. Now their body just gets lazy and doesn't make it. So you really want to prevent that kind of problem with it. So again, it improves a lot of things, overall wellness and decrease aging. Sometimes you see somebody, oh my God, I haven't seen them in a few years, and you see them and they're like, whoa, what happened? They age much quicker than you thought they would. That's maybe probably stress, cortisol, which we've talked in previous, but that most likely could be a very low growth hormone.